The number of pediatric flu deaths is estimated to be nearly 200 per season. About a quarter are kids under the age of 5. Also at high risk are children with underlying brain conditions.
The flu commonly causes respiratory issues, but in some children it can trigger neuropsychiatric issues.
These neuropsychiatric events included things like brain inflammation, seizures, and acute behavior changes like suicide attempts.
Also, anxiety and depressive episodes. Of the 150,000 children with flu, 1,500 of them suffered a neuropsychiatric event from the flu, but there were startling differences in those predisposed to brain disorders.
The rate of neuropsychiatric events was about 10 times higher in those with underlying psychiatric conditions and 100 times higher in those with underlying neurologic conditions.
But what triggers these neuropsychiatric events? Is it flu or Tamiflu?
There's a number of potential ways it can happen. It's very well known that flu can cause inflammation in the brain and cause something called encephalitis and encephalopathy that causes acute behavior changes.
But also,
the antiviral Tamiflu, or oseltamivir, has a black box warning for neuropsychiatric events.
Dr. Antoon advises parents to discuss these risks with pediatricians to decide about flu treatment or not.
Earlier studies reported to the CDC have shown that annually about 160,000 kids are diagnosed with the flu, and the risks are higher among adolescents for flu complications. That risk soars to 100 times higher in kids predisposed to psychiatric events.